Good afternoon, Year 11, and welcome today to your screencast for Health and the People, so your medicine topic. Today we're going to be looking at Edward Jenner, which links to flashcard 15 in your flashcard pack, and we are looking today at the industrial period. So Jenner sneaks into the industrial period, and the industrial period is 1750 to 1900. And if we think about our themes of medicine, disease, public health, and surgery, we'd definitely be saying that Jenner links with disease, and towards the end a little bit of public health, but it's mainly around this idea of disease. So some key words we need to know before we get started with Edward Jenner. Immunity is where you are protected from a disease. Inoculation is the idea where a doctor gives the patient a weak version of a disease to build immunity towards the full disease. And the vaccination is where a doctor gives someone a dead version of the disease to build immunity. So a dead version of a different disease, So really it's the idea of a different disease to build immunity. So I think it's best for you to remember the fact that it's just a different disease, so cowpox killing smallpox is a different disease to build immunity. And what's really important here is to know, before Edward Jenner, this was the common method to build immunity. So before Jenner, inoculation was common. It was all about inoculation. So Edward Jenner then. Edward Jenner did some research. Obviously he links with Hunter quite well. Hunter was kind of his teacher. Edward Jenner did some research and he found that smallpox was killing 30% of the British population. And when we look at this idea of inoculation, we have kind of inoculation here. So at the time, inoculation was the common method before Jenner. And if we look at it, so for example, with smallpox, what people used to do is doctors used to give a weak version of smallpox to build immunity to the full version of smallpox. So I'll go through that again. To prevent smallpox, doctors used to give a weak version of smallpox to build immunity towards the full version of smallpox. One important to mention, because I've just made the same mistake, is that inoculation and vaccination is a method of prevention to stop yourself from getting a disease. It is not a cure. So if you get asked about treatment of disease, you can definitely talk about prevention and cure. But if you just get asked about cure, you cannot talk about vaccination, because vaccination is not a cure. It's a prevention. So prevention is when you don't have it and you don't want it, and cure is when you already have it and you want to get rid of it. In terms then of opposition to inoculation, or the negatives of inoculation, first of all, we have the idea that it's interfering with God's work. It's still a religious society. Second of all, it was expensive, so the poor could not afford it. And finally, the doctors did not understand the dosage, which meant to them giving too much of the disease due to not understanding the dosage and the person dying as a result of that. So inoculation had its negatives. And then came Edward Jenner in 1796. And Jenner observed that milkmaids kind of came up with this rumour, and he watched some milkmaids that if you caught cowpox from cows, that you wouldn't be able to get smallpox. So Jenner thought this was really interesting, and what he did was he injected some cowpox into a boy, and then he injected smallpox, and the boy survived smallpox. So cowpox is harmless to humans. So he injected the cowpox into the boy, he then injected smallpox, and the boy survived. This shows that cowpox, Jenner realised cowpox would firstly not harm humans, and that it would then kill smallpox from if it tried to get into the body. And Jenner tested this on 16 different people, all with the same results. So it was successful, it wasn't just a one-off. And as a result of this, Jenner had created the first vaccine. And pretty much straight away, so we'll go to the negatives straight away. So if we go to the negatives here, we can see that with Jenner, lots of doctors at the time did not like this idea of vaccination because they would lose out money. So inoculation doctors would lose out on money because of vaccination. Edward Jenner also couldn't explain how the smallpox vaccine worked, so that was a negative. And then we also had William Woodville. So Woodville tried Jenner's experiments. So he tried the experiments and tried Jenner's experiments, and it killed people. It killed Woodville's patients. So Woodville said, no, Jenner's wrong. But what Woodville didn't realise is that it wasn't Jenner's methods that had killed the people, it was the fact that the tools he used were dirty. And remember, in the early industrial period, they didn't understand dirt was bad. So that's why they died. However, at the time, this was like a big thing, this was massive, and lots of people said, well, it doesn't work, you know, Woodville's tried and it kills people. So, you know, another negative against Jenner. But ultimately what we've got is the fact that Jenner did create the first vaccine, and that over time things started to get better, and people realised that, you know, the vaccination was a lot better. So in 1802 the British government gave Edward Jenner 10k to investigate his vaccination even more, and in 1853, which also impacts public health, the smallpox vaccine became compulsory, and the British population was vaccinated against smallpox, which was, you know, a massive win. It stopped the smallpox disease from spreading. And if we think about the long-term impact, we can see it on Pasteur and Koch. So they know vaccines exist. They just need to, when in another, I would say, you know, 60, 70 years, they know that vaccines exist, and they end up working out why vaccines exist. So just one last thing to add here is that a reminder that vaccination is a prevention. So it's a method of prevention. So that means, for example, with COVID, if I had COVID and then I had a vaccine, the vaccine is not going to cure me of COVID. However, if I have a vaccine, it is going to prevent me from getting COVID. If COVID tries to come into my body, the vaccine will kill the COVID germs trying to get into my body. But if the germs are already in my body, the COVID vaccine, if I have it, cannot do anything. So it's a method of prevention. So if you get a question on treatment, you can definitely talk about vaccination, because treatment is prevention and cure. So either or is fine. So prevention or cure. If you get asked a question about prevention, absolutely fine. But if you get a question about cure, you cannot. Because vaccines are not cures, they are methods of prevention. And if we have a look and we think about our themes of medicine, which I'll put up here, our factors of medicine, Ron Weasley is ginger, that's so crackingly cool. We can see religion here because inoculation is doubted in terms of religion. War isn't applicable. Individuals, Jenner, absolutely, and you can even link it to Hunter, the fact that Jenner learned under Hunter and Hunter kind of inspired him with his scientific method. The government help him give money to Jenner to help investigate. I'd be saying science as well, exploration and experimentation. And I would also say chance, the fact that, well, I suppose it is a little bit of chance that he heard this milkmaid rumour, but it's also science, the fact that he investigated it as well. So that is the story of Edward Jenner, and I would really advise you going over this because this was a weakness during your PPEs.